Good morning, everybody. My name is Sharon Spurlock. I'm the Senior Director of Family Education at the St. Louis ARC. And today I want to talk to you about the importance of registering with the Department of Mental Health and how to go through their application process. The first thing I want to say is that sometimes I think people don't want to go through the process to register because they don't think there's any services available for them. And that may be true. It may be because of a variety of demographics, you are not currently eligible for services. However, the Department of Mental Health is our statewide organization supporting people with developmental disabilities. And they are the ones that truly are the broadest base referral source for eligibility. So if you get through their process and you deemed eligible, then that eligibility can be renewed at any point, and it's going to help you pass the eligibility criteria for many other funding sources, including county tax boards like the Productive Living Board, DDR, DDRB, and DDA. It may help you with grant-funded services outside of those tax boards. So we really encourage families to apply for the Department of Mental Health. If you apply and you don't have Medicaid, you will be assigned an information specialist if you're deemed eligible. And I think of this as sort of an on-hold status. So that information specialist is going to be available to you as needed to help you with various processes that involve your loved one. So if they have annual funding come up that is for people without Medicaid, like the Northeastern Autism Funding Project, your information specialist can help you. If you get to the point where you want to apply for Medicaid, your information specialist can help you with that process. So across the state, there are 5 information specialists. If you contact them, you're going to get the person on call for that day, but each of them is extremely knowledgeable about how those systems work. So the document that I have up today is the map that was created by the regional navigation team in the St. Louis area to help you understand kind of the process of going through the supports. So there's a QR code on here if you want to dive in and get started, but we're going to go 1 through 6 and talk about what this map shows us. So number 1 is referral sources. So you can be referred on your own. You can be referred through a hospital, a physician, a provider, but ideally, just make the phone call. All you need to do is go to the Department of Mental Health website, dmh.mo.gov. It says Help with Developmental Disabilities. You click on that button. It's going to show you a state, and this area is going to tell you what region you're in. So in the St. Charles, St. Louis, and Jefferson City area, we're the light blue. So St. Louis Regional Office. This is for St. Louis County. Hannibal is obviously up in the Hannibal area. And then St. Louis Regional Tri-County includes St. Louis City, St. Charles County, and Jefferson County. So once you click on that link, it's going to give you the information to make a phone call. And all you have to say is that I would like to apply for eligibility with the Department of Mental Health. So that starts the ball rolling and will get you to the application and the interview with the intake specialist. So anybody can be referred. When you get to the intake process, there is an application. They're going to do a screening assessment to determine your eligibility. And some of the things that are basic for eligibility is you have to have active Medicaid if you want support coordination. And if you do not have active Medicaid, you can receive non-waivered services and you're eligible for PLB funded services. Both the PLB and DDR in St. Charles County, DDRB, I'm sorry, want you to have this eligibility in place prior to seeking services. It's not mandatory for St. Louis County, but it is encouraged. It's mandatory in St. Louis City if you want respite services. So, just a few things to consider. When we get to eligibility requirements, this is one of the things that becomes It's a little bit more complicated than it seems. So this is one of the reasons we encourage you to apply early because they do want a fair amount of documentation that proves that you have a diagnosis that occurs before the age of 22. So if you wait till your family member is 60, it's not going to be as easy to obtain those records from the school or the doctor that shows that they have had a disability for 40 years. So diagnoses that qualify are intellectual disability, cerebral palsy, epilepsy, head injury, autism, or a learning disability related to a brain dysfunction or other mental or physical impairment, and it has to occur before age 22. That's where the word developmental comes in. And finally, it has to be expected to continue indefinitely. It's not a situation where somebody has a medical condition that through therapy and treatment is going to change. And then they're going to look for substantial functional limitations in two or more major life activities. So when they say substantial, typically that means, and this is going to be, I don't even know what it means when I say this. They want it to be two deviations from the norm, the mean. So a fairly substantial limitation. So self-care. Can this person take care of their daily personal care needs? Can they feed themselves? Can they cook? All the things that you would need to be able to take care of yourself on a daily basis. What about their language development? Are they easily understood? Can they express their wants, their needs, their desires? Can they understand you when you're telling them things that they need to do or explaining choices so that they can make a decision? Substantial functional limitations in learning. Do they require an IEP? Are there adaptations that are required for them to successfully learn? Self-direction. This means that they are not able to plan and execute activities that they need to do to be successful in life. So for many people, for example, with autism, they lack the self-direction to complete homework assignments or stay on a job without extra support to prompt them to get through the different aspects of what needs to be done. Capacity for independent living or economic self-sufficiency, if the person's not able to hold down a full-time job, if they have inconsistency with a work record, if they also just need extra support for safety, for some of those other things we already talked about in a living environment. That's one of the categories, and then mobility, which doesn't mean how they physically move in their body necessarily, but it could mean, do they have the capacity to travel independently in the community? Are they able to utilize resources like transportation? Can they drive or take a bus to get where they need to go? So you don't have to have all six of these things, but you have to have substantial limitations in two or more. So that's going to be the big deal. And they're going to go and do a lot of research here. They're going to send out, they're going to ask you to sign forms for release of information, and they're going to send out lots of requests to schools, to vocational rehab, to doctors to try and prove that these things are true. So once that has happened, you would be deemed eligible or ineligible. If you're eligible, it's going to be one of the two things we spoke about earlier. Without Medicaid, you can use an information specialist and have access to any programs that don't require Medicaid. With Medicaid, you have access to support coordination. That does not give you access to funded services. That's the next step. So we're going to go to number 4, support coordination. They're there to help you figure out what you are eligible for, to help you advocate for services that you need, to help you find the different resources that are available in our community, to help you look at other interventions like in-home support or behavioral assessment, and then have crisis intervention. If you're truly in a behavioral crisis, are some resources that are available to you through support coordination. So a support coordinator is required to get to know you and complete an annual support plan. That plan should occur with the person with the disability and the people that are important to them. And in that planning meeting, you identify all your goals that you're looking for in the next year. You clarify the outcomes you want to have happen, whether those goals are to get a job, to move, maybe it's to become more independent in your own home, maybe it's to have more access to community connections and make friends, and have respite for the family. So you define those outcomes, identify the services and supports that are needed to achieve those outcomes, and then the service coordinator or support coordinator is going to write the plan, including an action plan on how to get there. All of us are going to ask you to look beyond paid services. So some of your things may be able to be achieved by utilizing something that's available to the public, like public transportation, utilizing the library, utilizing the local parks association. So we're going to encourage you to use some natural supports. Maybe it's technology or a friendship. We're also going to refer to other agencies. And then your plan, if it requires services that could be funded through the Department of Mental Health, would go through the Utilization Review Committee for approval. That is not going to happen probably unless you have one of the Medicaid waivers. Home and community-based supports are a waiver-based support service. So look to our other videos to learn more about Medicaid waivers and how to access those. So this is just your first step in the process. And then down at number 6 are some of the support options that are paid for through those waivers. There are some services that are paid for by waivers through the Department of Mental Health. There's other services that are paid for through waivers through the Division of Health and Human Services. So they may recommend that you seek out supports there for in-home services, for stabilization and crisis support. Maybe they'll refer you to the FFAP Autism Project to get funding from that program. There's rehabilitation that's straight Medicaid funded that you could get access to, and then other services that are available through your county tax dollars. So at this initial stage, there's not going to be money tied to your connection to the Department of Mental Health. Your next step would be to move forward with seeking out waivered services. So this was a quick overview of steps 1 through 6 to get connected to the Department of Mental Health, have them deem you eligible, and assign you either an information specialist or support coordinator to help you move forward with making plans for your future. We are encouraged to include your support coordinator anytime we're going to do navigation. You should go through support coordination first and see if they can help you, or work with us in conjunction with the support coordinator if that has not been effective. So thanks for listening today. I hope you have a great day.